My name is Courtney Doyle. I'm a bariatric and minimally invasive surgeon here at Anne Arundel Medical Center. I started my career in Indiana, which is where I was interested in medicine and completed my medical school and residency training. Then I moved to Maryland to do a fellowship in bariatric and minimally invasive surgery and have stayed ever since and practiced in that specialty. There are several different types of bariatric surgery available. The two most commonly performed in the United States are the sleeve gastrectomy and what we call the full gastric bypass. The gastric bypass is slightly different from a sleeve in that we create a small stomach pouch similar to a sleeve, but we also rearrange some small intestine. The lap band is another operation that's available in the United States, but becoming less and less frequently used, which is actually a ring of plastic that's implanted at the top of the stomach itself. The differences between the three are in relation to the degree of weight loss, in terms of how much weight you lose with each particular operation, and then in terms of the things you might have to worry about in the long run with each operation, meaning what your lifestyle will entail after a sleeve is different from what it will entail after a gastric bypass. The surgery that Sarah is going to undergo is something that we call a sleeve gastrectomy. It is performed laparoscopically, which is the way most bariatric surgeries are performed these days, which means multiple very small incisions as opposed to the very large incision the way we used to do bariatric surgery. The sleeve gastrectomy itself is actually going in with a laparoscopic stapler and removing anywhere from 60 to 80% of the stomach. I actually met Sam and Sarah months ago. Sam was first to come into my office. He told me he and Sarah had been thinking about this for a long time together as a couple. They felt like they were in a position where they were ready to do well and support each other through the process. They want to be active and healthy for the rest of their lives together. They're looking for a way to be able to do that, and this surgery is a very nice way to help them get to a healthy lifestyle without having to feel every day like they're constantly on this diet. So most of my patients are that way, and that's the reason bariatric surgery tends to work so well.